What are some of the unique effects of local anesthetics in the body during their clinical use? The sensitivity of different tissues to local anesthetics varies greatly based on the density of the sodium channels. Remember that only tissues with sodium channels have receptors for local anesthetics. Of those tissues, nerves are the most sensitive. Now, why is this? Because nerves express the highest concentration of sodium channels and their associated local anesthetic receptors. Even amongst nerves, there are some that are more sensitive to local anesthetics than others. For example, small, unmyelinated nerves are more sensitive to local anesthetic than large, heavily myelinated nerves. The reason for this is not just size, but their relative lack of myelination. On a small diameter unmyelinated fiber, action potentials can jump from one node of Ranvier to another, bypassing a blocked segment on that nerve more easily than on large fibers that are myelinated. Because of their myelination, larger nerves are very efficient in propelling the wave of depolarization quickly and over long distances. As a result, a larger region of myelinated nerves needs to be affected by the drug to block the propagation of action potentials. Smaller, unmyelinated fibers, on the other hand, are less sophisticated. The wave of depolarization moves more slowly and can't jump at all. So they're blocked more easily by relatively lower doses of local anesthetics. Another clinical situation that can influence the sensitivity of tissue to local anesthetics is chronic inflammation. Chronic inflammation actually stimulates the synthesis of sodium channels over time. As you can see here, 4 days after the injection of carrageenan, an inflammatory compound, there are visibly more immunoreactive sodium channels in nerves projecting to the inflamed limb than in the contralateral side of the animal or in naive animals. The consequence of this upregulation of sodium channels is that the animal becomes more sensitive to pain, a protective response to avoid tissue damage. However, enhanced sodium channel density also makes the nerves more sensitive to local anesthetics. So the worse the sensitization to pain, the more sensitive the nerves are to local anesthetics. Another situation in which there's a change in the sensitivity to local anesthetics is in the heart. Local anesthetics can decrease cardiac output, in part by decreasing heart rate, even in a normal, healthy individual. But the effect of local anesthetics in a patient with a rapid or irregular heart rate is even more dramatic than their effect on a normal heart rate in a healthy animal. This is not due to increased synthesis of sodium channels. Rather, the reason for this is that the local anesthetic inside the cell is allowed to enter the sodium channel more easily when the channel opens more frequently. A similar phenomenon occurs in neurons transmitting pain. These neurons are called nociceptors when they're very active. When nerves discharge frequently, for example after an injury, local anesthetics can enter the open channels more readily and inhibit severe pain at a lower dose than mild pain. Most local anesthetics are relatively non-toxic at the site of injection, but toxicity can result from the redistribution of the drug into the rest of the body, where it can influence the heart, the brain, and the vasculature. Commonly, toxicity results from an inadvertent intravenous injection. The blood pressure effects that are produced by a combination of effects on the heart and blood vessels are summarized here. In the heart, there's an increase in the refractory period, a decrease in the conduction rate, and a decrease in the force of contraction. Together, these lead to a decrease in the cardiac output because of a decreased heart rate. In the vasculature, local anesthetics inhibit the release of acetylcholine from sympathetic ganglia. This attenuates sympathetic tone that's important in maintaining tonic vasoconstriction to support adequate blood pressure. In addition to that, local anesthetics decrease the excitability of smooth muscle in vasculature, causing a direct inhibition of vascular smooth muscle tone. Together, the decrease in sympathetic tone and the paralysis of vascular smooth muscle directly decrease the total peripheral resistance, or TPR. So decreases in cardiac output, the effect of local anesthetics on the heart, together with decreases in the total peripheral resistance, the effect of local anesthetics in the vasculature, work together to produce a dramatic decrease in blood pressure. What are the signs of toxicity that you should be looking for to ensure that the doses that you've administered haven't accumulated excessively? Because of a disinhibition of inhibitory tone in the brain, you may see excitation and even convulsions. This may be followed by a period of depression characterized by sedation and listlessness. Cardiovascular effects may include a decrease in the heart rate and blood pressure. Acidosis and hypoxia may worsen the cardiovascular effects, leading to cardiovascular collapse. Because muscle is also sensitive to local anesthetics, and especially the nerves leading to muscles, you may see uncoordinated contractions and muscle tremors that precede the convulsions. Finally, and most seriously, you may see cardiopulmonary depression, and this may be the cause of death. What do you do in a case of toxicity? Therapy will depend on the clinical issues at hand, of course, but there are three main things to consider. These include fluid therapy to help maintain blood pressure, administration of anticonvulsants to treat seizures, and support of respiration. Of course, the most important thing is to try to avoid toxicity in the first place. Always use the lowest dose and the smallest volume possible for the procedure that you're doing. When you have a choice of compounds, you might want to take care if you select highly potent and toxic compounds like bupivacaine. In some cases, it's possible to inject the local anesthetic with a vasoconstrictor like epinephrine. This will reduce the redistribution of the drug and prolong its action, decreasing the amount of drug needed to produce an effect and decreasing the possibility of side effects. But it also decreases blood flow and may cause tissue damage. In addition, if given IV inadvertently, it can cause ischemia or cardiac arrhythmias in susceptible patients. So including a vasoconstrictor can be dangerous. Aminother rule of thumb is to keep an eye out for animals that have hypersensitivities. Many animals are allergic to para-aminobenzoic acid, PABA, the metabolite of some ester-type local anesthetics, so they should be avoided wherever possible. The symptoms of an allergic reaction include such things as urticaria, or in severe situations, maybe even asthma. Some species have specific reactions to local anesthetic that need to be noted. For example, methemoglobinemia is a condition that's often caused by the use of compounds like tetracaine and benzocaine in cats and rabbits especially. However, all domestic species are susceptible. Methemoglobinemia is the result of the oxidation of the iron in hemoglobin from the ferrous state to the ferric state. The ferric state binds water instead of oxygen, resulting in hypoxia. This is characterized by a blue tint to the skin. You may also see fatigue, failure to thrive, and seizures when given over long periods of time. So how are the local anesthetics administered? You'll learn more about this in the clinic, so this will just introduce you to some of the terminology. The simplest way to use them is topically, such as proparacaine drops on the cornea for an ophthalmologic exam. This is topical or surface anesthesia. Local anesthetics like lidocaine are often used for infiltration anesthesia. This involves the injection of solution into and around the surgical field to block nerve endings rather than one specific nerve. This can be done as a single injection using needle and syringe, or a catheter placed to allow a continuous or intermittent delivery of drug into the tissue without repeated needle punctures. Another way to use a small amount of drug but anesthetize a large area of the body is to inject a small volume of relatively concentrated solution adjacent to a peripheral nerve that projects to the area of interest. This is termed regional or nerve block anesthesia. This technique is commonly used in domestic animal species to provide intra- and post-operative analgesia. The administration of local anesthetics into the epidural or subarachnoid spaces can be effective in relieving pain. This is termed neuraxial anesthesia. Intravenous regional anesthesia is one of the oldest uses of these drugs. A tourniquet is applied to the limb, and lidocaine is injected into a peripheral vein, desensitizing the limb. Finally, local anesthetics can be injected into joints, causing intra-articular analgesia. This technique desensitizes intra-articular structures without affecting the extra-articular area, such as the bone and soft tissue and skin. Based on the information in this videotape, you should be able to identify a variety of applications of local anesthetics in veterinary medicine. You can now appreciate their advantages in pain management over other, more primitive methods. You now know that you have choices to select appropriate drugs for specific uses, and you should understand that what contributes to their fate and their toxicity so that you can control these situations. Finally, you should also be able to clearly and simply explain their mechanism of action to clients and to technicians.